Welcome to this tutorial on RVUs. The RVU is the relative value unit. And an RVU is a number that describes the time, the intensity, the level of training and skill required for a physician to do something. RVUs are somewhat of a new concept, but they're generally gaining traction across the country, especially in academic centers where administrators are trying to quantify how much effort physicians are putting in when they take care of patients. One of the easiest ways of determining how much effort someone is putting in is to look at how much money they collect from the services that they provide to patients. But that's problematic because a lot of patients don't have insurance or don't have good insurance and don't pay. And if you're a physician who takes care of patients who fit that bill, who don't have great insurance and don't pay for the services you provide, it would appear to administrators that you're not doing a good job and you're not working very hard. So the RVU concept kind of negates any patient-specific financial considerations and simply focuses on what you're doing for the patient. The total RVUs is broken down into three categories, and the first is your WRVU. That's what we're going to focus on the most. But just for completeness, let me tell you what the other two RVUs are. There's a practice expense RVU. I'll briefly tell you what that is. And then there's a malpractice RVU, and I'll tell you what that is. So every procedure, every service you provide, whether it's a procedure or not, has what's called a CPT code. That's the code that Medicare and the AAMC have come up with to describe what you've done. So if you see an established patient and you bill a level 4, there's a code for that, a 5-digit code. If you put in a vascular catheter for temporary dialysis, there's a code for that. If you're doing a kidney biopsy, well, if you're doing a native biopsy, there's a code for that. If you're doing a transplant biopsy, there's a code for that. There's always a 5-digit code for everything that a physician does. And those codes can equate to your WRVU, which is what number you get assigned as a physician for the effort you've put in. The WRVU depends on 4 things: the level of skill required to do the particular service or procedure, the amount of training that you have that's required to offer that service, the time it takes to offer that service, and the intensity that is required to offer that service. So based on these 4 parameters, CMS comes up with a WRVU for a particular CPT code. And the more WRVUs you get, administration generally feels that you've done more work, you've worked harder than someone who's generated less RVUs. The practice expense RVU is something that you don't really control. CMS basically tells you for the type of practice that you run, this is the amount of RVU you'll get when you provide a particular service in that practice. So it's supposed to take into account your office expenses that are required for you to provide a particular service as indicated by the CPT code. And something similar happens here with malpractice RVU. If you are looking at a particular CPT code, there's a particular amount of malpractice that will be needed to cover you in case something goes wrong for that service or procedure. That's where you get an RVU for that. And then you add these 3 together, you just sum them up, and that's your total RVUs. For physicians in academia, we generally focus on the WRVU because that is what our effort is measured upon. So we'll talk about WRVUs in the next video. We'll look at some specific things, services and procedures that nephrologists provide, what their general WRVUs are, how RVUs are actually derived and how they're changed over time, and then we'll go through some scenarios of what services you could provide to give you more or less WRVUs.